Welcome back on this Saturday. Heart disease is not just a man's problem. It's also a major women's health threat. News Channel 5's Alicia Roberts talked to Dr. Lori Mosca from the U.S. Department of Health about the importance of making healthier lifestyle choices to take charge of heart health.
February is American Heart Month, and here in the United States, a woman suffers from a heart attack every 60 seconds. Joining me right now, Dr. Lori Mosca. Dr. Mosca has been a past chair of the American Heart Association Council on Prevention. She's also the current spokesperson for the U.S. Department of Health and Human Services Women's Office of Women's Health. Dr. Mosca joins us today with a really important message for all women. Dr. Mosca, this disease is so pervasive. In fact, it's the #1 killer of women.
Absolutely, and many women are not aware of that fact. Indeed, every year more women die of heart disease than men. So the purpose of this campaign is to really raise awareness, not only that heart disease is the leading killer, but specifically what we're aiming to do is to help women learn about what the symptoms are of a heart attack and what they need to do if they think they're experiencing one.
Okay, and Dr. Mosca, what are the symptoms for women? Because they can be slightly different than those typically found in men.
Many individuals are aware of the Hollywood heart attack, this sort of crushing chest pain. But what we also need to be aware of is that there are less common symptoms of a heart attack. And these include lightheadedness or dizziness, shortness of breath, pain radiating to different areas of the upper body, could be down either arm, to the jaw, the neck, or the back. Indeed, symptoms of nausea, stomach upset, indigestion could also be a heart attack. Breaking out into a cold sweat, or even just symptoms of extreme exhaustion are occasionally a heart attack. So it's important that women understand these, because these actually occur more frequently in women than men. And what's a big concern to us is that last year the American Heart Association conducted a survey that showed only 50% of women knew the symptoms of a heart attack. And unfortunately, the women who were least aware were those at highest risk, so minority women, less educated women. So we've got to make sure we know what those symptoms are and that we get the help we need.
And Dr. Mosca, you know, as women, we're moms, we're always used to taking care of everyone else, sometimes putting ourselves last on the list. But your message this year is, if you're feeling those symptoms, if you think something isn't right, make the call. Is that correct?
Absolutely, make that call, because research has shown that only 50% of women will call 911 if they think they're experiencing a heart attack. But 70% of women in our national study said that they would call 911 if they thought somebody else were experiencing a heart attack. So what we're trying to really do is not only educate women about what the symptoms are, but also to empower them to make that call. Women need to recognize that the longer that they delay, you know, many women are in denial about this. You know, they don't think it could be happening to them. But every minute they delay, they increase their risk of death.
Well, Dr. Mosca, an important message for us, not only this February, but all throughout the year. We'll tell our moms, we'll tell our sisters and our daughters. Thanks for bringing that to us. Stay healthy and well in 2012. Again, Dr. Lori Mosca from the Office of Women's Health. Thanks, Dr. Mosca.